Live from ABC 7, this is Eyewitness News at 7:30 p.m. on KDOC TV.
Medical experts think a COVID-19 vaccine will be needed before we can go back to any type of normal life, but will people choose to get it? Good evening, I'm David Ono.
And I'm Colleen Sullivan. This is Eyewitness News on KDOC TV, LA's only live local newscast at 7 p.m. The number of COVID-19 cases in LA County still climbing, surpassing the 40,000 mark today. In Orange County, 10 new deaths today, the most of any day since the pandemic began, and particularly noteworthy because they previously had only 88 deaths total, and they had 0 new deaths the past 2 days. Meanwhile, Ventura County becomes the first and largest county in the state to get the green light to fully reopen.
And medical experts say the nation will need a COVID-19 vaccine to quickly get back to some form of our previously normal lives, but a recent poll shows not every American would get the vaccine. Eyewitness News reporter Josh Haskell got details from an infectious disease specialist.
Infectious disease experts believe a coronavirus vaccine is key to returning to some version of our previous normal, with roughly 50 to 80% of the U.S. in need of immunity for the virus to retreat. Dr. Anthony Fauci says a vaccine could be available as early as January 2021, but a recent ABC News poll found 1 in 4 Americans would likely not get the vaccine.
People should have a choice, but I think sometimes you need to put aside your own strong feelings about it for the common good. And I think if it helps our economy, it helps getting us back to a normal routine, and helps decrease the risk and actually affecting others adversely, then I think one should do that. One should make that sacrifice.
Dr. Leo Lee has been treating COVID-19 patients at Beverly Hospital in Montebello and imagines the coronavirus vaccine being similar to the flu vaccine, which he says is very effective even though it's not mandatory. Just 47% of Californians got a flu shot during the 2018-2019 flu season, ranking 36 out of 47 reporting states.
It's never 100%. At least, even if it's 50%, which it has been in the last few years, at least partially protective. So even if you happen to contract the illness, your illness tends to be mild, and you may be out for a shorter period of time.
When it comes to compliance, Californians are more likely to get the measles vaccine and wear a seatbelt, both mandatory, than they are to get the flu vaccine. Over 95% of Californians got their kindergartners vaccinated against measles last year, ranking 10th in the country. And according to data from the U.S. Department of Transportation, 96% of Californians wear their seatbelt, ranking 2nd in the nation.
If the estimates are correct for the percentage of Americans who will need herd immunity, then a portion of those who don't get the flu shot will have to come around and get the coronavirus vaccine. In Los Angeles, Josh Haskell, ABC 7 Eyewitness News.